Chapter 1: The Cost-Benefit Ratio. Have you ever stopped to ask whether a treatment that promises to fix a young person's curved spine might, in the long run, bend their life in ways nobody intended? That single, unsettling question sits at the heart of skipping scoliosis surgery, why parents and patients for choosing non-surgical solutions, and frames the central dilemma that thousands of families face every year when a doctor recommends spinal fusion for adolescent idiopathic scoliosis. On one side of the debate is a procedure that has become almost routine in orthopedic practice, praised for its power to straighten vertebrae, halt further curvature, and give X-rays that picture-perfect look of alignment. On the other side is a growing body of evidence and an equally growing chorus of patients suggesting that the knife is not always the knight in shining armor it appears to be. Complication rates, hardware failures, surgical revisions, chronic pain, adjacent segment degeneration, restricted athletic ability, and the very real possibility that a cured spine can feel stiffer, weaker, and more fragile than the flexible one it replaced, all raise the uncomfortable possibility that the operation designed to save the day may shadow a teen's tomorrows. Against this backdrop, I invite you to zoom out, slow down, and examine the big picture. When, exactly, does the surgical cure create more problems than AIS itself? Is trading deformity for spinal dysfunction worth the trade? This introduction lights the path we will follow and, like any good trail marker, tells you what to expect around each bend. First, we will explore the natural history of AIS, how most mild to moderate curves behave over time when left untreated, why some curves progress while others remain stable, and what factors truly predict risk. We will examine large-scale longitudinal studies that track patients well into adulthood, revealing that many teens with modest curves live full, pain-free lives without ever seeing an operating room. Next, we will open the surgical ledger and tally the benefits alongside the liabilities. That means looking beyond the immediate, photogenic post-operative X-ray to the months, years, and decades that follow. We will sift through peer-reviewed literature on fusion efficacy, average correction angles, reoperation statistics, infection rates, hardware fatigue, pseudoarthrosis, and the often overlooked emotional toll of extended recovery. Because numbers without context can be misleading, we will weave patient voices and real-world stories into this evidence tapestry, giving every percentage point a human face and every data table a beating heart. Yet, this book is not a stump speech against surgery. Rather, it is a balanced inquiry into timing, necessity, and alternatives. Accordingly, the third strand of our analysis examines modern non-surgical care at its most innovative: brain-based reflexive-response rehabilitation, genetic and metabolic testing to uncover progression risk markers, personalized nutrient and hormone balancing, and wearable devices like the ScoliSMART Activity Suit that train neuromuscular pathways during everyday movement. We will compare these proactive strategies with conventional watch-and-wait orthopedics, evaluating how early intervention programs can sometimes stabilize or even improve curves while enhancing strength, coordination, and self-confidence. We will highlight emerging research on the interplay of neurotransmitters like serotonin, norepinephrine, and histamine, genetic variants such as MTHFR and COMT, and hormonal shifts that influence ligament laxity and bone density, showing how targeted, non-invasive therapies can modulate many of the same biological levers that surgery aims to overpower mechanically. In doing so, we will ask a fundamental follow-up question. If we can correct the underlying signals that tell a spine to twist, do we still need to screw the bones together? Our journey will also pause at the crossroads of quality of life, because the true measure of any intervention is not merely curve magnitude on radiographic images, but the everyday experience of the person inside the frame. We will listen to teens who traded bracing fatigue for renewed athletic freedom, athletes who declined fusion and went on to win collegiate scholarships, and adults who regret surgeries performed before fully developed discs and growth plates could voice an opinion. Conversely, We will honor stories of patients whose severe curves threatened lung function, underwent fusion, and gained a stability they cherish today. Their lived experiences underscore a key principle. Every spine tells a different story, and every decision must account for the whole person, body, brain, and future dreams, not just the curve. To guide readers through this complex landscape, we will adopt an evidence-based approach that is both non-biased and accessible. Whenever I cite statistical outcomes, I will translate percentages into plain language comparisons, 1 out of 4, not 25%, so families can feel data rather than fear it. When we discuss surgical techniques, we will define terms like pedicle screw, rod contouring, and bone graft in everyday vocabulary, ensuring no reader feels locked out of the conversation by jargon. At the same time, we will keep our compass set on peer-reviewed research, PubMed-indexed trials, and registry-based cohort analyses, recognizing that the science of scoliosis evolves rapidly and deserves continual, critical appraisal. Throughout, you will see side-by-side snapshots of surgical and non-surgical pathways, their immediate goals, their likely long-term outcomes, their potential lifelong ripple effects. By laying these options shoulder to shoulder, we empower families to choose from a position of knowledge rather than fear. Before any final decision is made, every family deserves an honest, objective, and open conversation about the real-world cost versus benefit balance of scoliosis surgery. That discussion should weigh not only hospital bills, rehabilitation time, and the possibility of missed school or work, but also the intangible costs, temporary loss of independence, stress on siblings, and the psychological toll of living with permanent hardware. Equally important, it must measure the potential benefits in human terms: pain relief, curve stabilization, and peace of mind. When all sides of the ledger are laid bare and the patient's long-term goals are kept at the center of the dialogue, the resulting choice, whether for or against surgery, truly serves the patient's best interests. Ultimately, this introduction is both a doorway and a promise. The doorway opens into a discussion bigger than any single medical specialty, because scoliosis care now spans orthopedics, neurology, genetics, endocrinology, physical therapy, psychology, and functional medicine. The promise is that every page ahead will respect your capacity to weigh evidence, honor your right to question authority, and recognize that first do no harm applies as much to overtreatment as it does to neglect, in the chapters that follow. By the final page, our goal is simple: to replace the anxiety of, "What if surgery is my only hope?" with the clarity of, "Here are all my options, their pros and cons, and the path that best fits my child's unique spine, lifestyle, and future." If that promise resonates with you, turn the page and let us begin the journey together toward informed, confident, and compassionate scoliosis care.